Okay, it is now July 25th, 2022, and it is approximately 6:03 in the evening, and I'd like to bring this meeting of the Board of Health to order. First on the agenda, we have 56 Bigelow Road waiver request. Alpha English, is that correct?
Alpha Omega.
Oh,
Alpha Engineering.
oh, Alpha Engineering.
Alpha Omega.
Okay. Do we have a representative from?
Yes, you do.
Okay.
My name is Brian Slitzowski. I'm the owner of 56 Bigelow.
Okay. Could you explain to us where Bigelow Street is located?
I'm sorry?
Could you possibly explain to us where Bigelow Street is located? Because we're not familiar with it.
It's on Manchild Lake.
Oh, okay.
So it is over by Lake Manchild Camping. There's a couple of roads down the back.
Yes, yeah, okay. I have a pretty good idea of where it is.
Yeah, I got it.
So currently we're doing, my neighbor is doing his, so our septic is on the front of the house towards the lake. We're moving it up towards the road. And then we're putting the well down towards the water. So we've coordinated with the neighbor who's doing the same thing.
Yeah.
He's rebuilding his septic and drilling a well as well. So I think we're just within the 100 feet, but not that much.
Okay, isn't it like 51 feet from one location of the well to another?
I believe so, yes.
It's 51, is it 51 feet?
51, yeah.
51 feet. Okay.
So currently we don't have a well at all.
There's no well at all?
No. We draw water from the lake.
Okay, so you bring in water?
Oh yeah, we don't drink the water from the
Right.
lake, yes.
Right.
We use it for, washing clothes and
Okay.
taking showers, yeah. So that's the way we bought it, we had water. And there's a dug well in the front that has been operational, which we plan on removing.
Uh-huh.
And the water we use is for sink and shower, doing dishes is from the lake. So we're hoping to move the septic from the front, get it up top, so we're not leaching
Right.
into the water.
Right.
And so we have to put this well at the other end.
Okay, I see. Are there any other wells besides these two? No, nearby, like shallow wells or anything that you know of?
No, I think that's the reason that the neighbor is drilling his as well, because I believe he has a dug well, and he has a lot of problems with it, so he's petitioned for a well. And I think he's 54 Bigelow, so
Yeah.
either that has come before you or will be coming before you. Him and I had this discussion.
Okay. I didn't get a chance to speak with the engineer, however, I did hear that he did approve of this 51-foot distance from well to well. Just take a look at it, trying to get familiar with it here. Okay, so we have elevation, actually, 100. So actually, the well is, the grade is pitching away from the well or toward the well? Existing well?
The new well, the grade would be pitching towards the house grade. Is that, you mean the house grade?
Well, I'm looking at it 97.5 at the, let me see, at the
There's not
septic.
much of a grade there. That's pretty flat.
Pretty
where the well's
flat.
going to
Yeah, it
go.
goes
I would say
97, yeah.
probably in a 50-foot span, it might be a foot difference. of elevation.
Okay, yeah, it says to 100. Are there other drilled wells in the area? I mean,
There are, the neighbor to my, I don't know the direction, but so let's say just to the right of my house, his septic, I believe, the reason we're on the left, facing the pond, the reason our well is on the left is because the gentleman on the right's septic is, so we're outside of that requirement so we didn't move it to the right side of our house so that we wouldn't be within the limits of his septic, and that gentleman has a drill well up top. So, he has a bigger piece of property than I do, so
Yeah.
he has a drilled well, and I'm not too sure of the other neighbors, because they're not really that close to us.
not that it makes a big, well, it probably makes no difference at all, but do you know how deep his well might be?
I do not.
Yeah, okay. What do you folks think? Any ideas on that?
It looks, there's a thing in here that says 50-foot wetland buffer.
Yeah, we've been to conservation already.
Yeah, yeah.
And then there's another one that says well to be abandoned. How does a well get abandoned?
Yeah, that's the other, that's a dug well. I think that was there in the 40s and 50s. It's a hand pump crank that hasn't worked, or we don't use it, so we're planning on removing that.
Right.
Oh, I think you're talking about the neighbors. I think this is the one he's talking, towards the front of the house, there's an existing well, and then towards the back of the neighbor's property, in the corner, there's an existing well. To be,
Yep.
both are to be abandoned, it looks like.
Yeah, yeah.
On the new plan.
That's my understanding, yes.
Yeah, that would have no impact on this.
Underground propane tanks being relocated too. But then,
Yeah, that's at the top of the driveway, so that's quite a ways from the well.
yeah. Bob, you said that you spoke to the end, or you didn't
I'm sorry?
speak to, you didn't speak to the engineer, but as far as your
I didn't,
understanding
but
goes, you-
right, I heard from the engineer that he approved it, he felt there's no problem. Actually, state regulations would approve this
Yeah,
as well, because of 50 feet.
and it's an upgrade on the current system. Right?
Yeah, absolutely. You're really limited what you can do in that area.
All these lake
It's
areas,
so, I
right?
mean, anything, almost anything is an improvement,
Yeah, all these lake houses are packed,
Yeah.
and right now is, well, the water's
I would
being
suggest
pumped out of
that,
the pond.
I would suggest that it's fine, but,
Yeah.
you guys, if I could get a,
Proposed well. Man, so they're gonna put an artesian back there, huh? There's enough room for them to get the truck back there?
There is when the house is down.
yeah, yeah.
Yeah.
So, what do you think? Do we have a motion here?
Wowzers.
Do you want a motion contingent on acceptance by the town
Absolutely,
engineer?
absolutely, yes.
All right. I'll make a motion that we accept the waiver request.
Okay.
The distance from proposed system to existing abutting well, 100 required, 51 provided, and do I think that two separate motions, or can I?
I think you can do it.
As well as the distance from the proposed system to the proposed, in the proposed well to the proposed septic.
Right.
As written.
Right.
To 92.1 feet instead of the required 100.
That's right.
So yeah, I'll make a motion that we accept the plans as is, contingent on the town engineer's approval of said plans.
Right. All in favor?
I'll second that.
A second?
Yeah.
I'm sorry.
And the
I
kid likes
guess
it.
it's third.
You're right, the kid likes it too.
All in favor?
Aye.
Aye.
Okay, I guess it's all set. You're good to go.
Yeah.
Wait, do we count the kid as an eye as well?
Yeah, absolutely, absolutely.
Yeah, as
In fact-
many as you can
in
get.
fact, that was a swing deal right there. That was-
All right. Yeah, good luck. Good luck in this house.
Thank you very much.
Yep.
I appreciate your time.
That's
Bye
gonna be a
now.
beautiful place.
It's a nice
Thank you.
location.
I know, 2 decks.
Yeah,
Why not? It's gonna be really nice.
yeah, nice location.
Oh, there's just not a lot of options for septics and wells about there.
No, there are very, very few options.
That's a leach too, right? It wasn't a
Yeah.
tank, it's a leach, so.
Okay, I can never fold these things, you know? Okay, well, let's move on here. We have transfer station tonnage, which we'll get back to you on that. So we have bills and warrants. I haven't even looked at them.
Well, they were all signed.
I know, but that doesn't mean I looked at them.
They all looked good when I looked through them.
Yeah, me too.
Yeah, let's just make sure the town engineer doesn't mind that 51 feet.
No.
That's the only.
We've had to do that in the past, too, you know.
Yeah, 51's still a long ways.
It is. It
But for
really
the
is.
neighbors well, and the neighbor wasn't here to,
Steve already approved it.
oh, and
Yeah.
the neighbor's not here to say like,
Steve,
whoa.
Steve had no problem with it, so.
Then, I trust him.
Yeah.
Excellent.
So easy.
Yep, just the way
He's
I
okay with it.
sign, that's just the way I sign them.
Don't you love that? Yep. Yep, they still all look the
They
same.
all look the same.
How's that rubber stamp working?
That's perfect. All right.
Okay,
Looks like-
next is me. Had a few things over the passive time here. We mentioned on West Street, what number West Street is that? It's about halfway up West Street, between Route 16 and the Res. Okay, it's about halfway up there. The house was condemned, pretty bad. The man that was living there was a veteran, and he really couldn't take care of himself.
Yeah.
And although his family lives next door, it just wasn't appropriate for him to move in with them, and it wasn't going to work.
Yeah.
So, we have the assistant, Danielle, who's been helping us out. She went up, inspected. She determined that it had to be, condemned. So, I don't know if there's any movement on selling the property or whatever the case may be, but it's not livable. It's impossible, not livable. So, long story short, he's been placed in a home somewhere in Worcester, and it's for veterans. So at least he's safe. He has a place to live, food, clothing, all that. So he's safe. We're okay.
It has
there.
heat, right? This was that place that had no winter heat?
No heat, no water.
No water?
It was nasty. It was terrible.
Too far gone.
Yeah.
It's too bad.
It just had been neglected for years and years.
That's
and
too
years.
bad. We couldn't have helped him out 10 years ago when he probably needed it, you know?
Yeah.
That's the thing.
But, it's like anything else. I mean, this is your home. You're reluctant to leave it. You don't want to leave it.
Right.
And you don't want to ask for help, right?
No,
Sometimes it's hard.
no. But I think he's settling in pretty well, I think. I haven't spoken with Danielle, but we haven't heard anything different, have we, Kristen?
No,
No.
I hope
getting
so.
help, so.
Yeah.
That's hard to take somebody out of their home, so I hope
It
he's
is.
doing well.
It is. He had a tough time with it, but,
Oh, sure.
at least he's safe now, so.
How long had he been there, do you know?
Oh, God, that family's been there for years.
Oh, so
Yeah,
he raised his kids in that house and,
I think it was his mother's house.
yeah,
oh, geez.
yeah. She left it to him,
Oh, boy.
and the brother lives right next door,
Yeah.
and he's fine. Their property's okay. And
Right,
everything,
right.
But, I mean, this guy had no means of taking a shower or anything. It was just not good. So at least now he's in safe hands.
Yeah.
Okay, and then that was number one. Number two, we had another inspection that we had to address, and that was the Chinese restaurant down here on Route 16. Was it Danielle?
Nope, Daniel.
Daniel? Daniel, he's another one, he's the other assistant that we have.
Yeah.
He inspected that, and he found, I think, at least a dozen violations. Pretty serious ones, too. But the good news is they did manage to get an interpreter, or not an interpreter, but is it an interpreter?
Oh, the woman that came?
Yeah.
No, she actually works, it was Deb. She is also part of the grant as a
Oh,
health nurse.
but didn't she know how to speak the language?
No,
or-
she made up posters and everything in Chinese and all different languages.
Okay,
And went over like how to properly clean your
Right.
hands
Right.
with them.
They came, they really didn't understand. I mean, part of it was the fact of the matter is there was a language barrier there. And I guess this woman helped to address that.
Okay.
And they're trying very hard to meet the standards now, which is good. I mean, we don't want to deliberately put people out of business. However, they have to meet certain standards, of course. And we're willing to work with them, too. And you know as well as I do, Corey, because you were an agent, you dealt with the same issues. And, you have to work with these people the best that you can. So that's that one. And then we have, Daniel went out on an inspection for the water slides. Few violations there, very few. I was most impressed with the fact that they run a very neat operation, very neat. You walk through that area, their area, and you can't find a piece of paper on the ground. As soon as somebody throws a piece of paper on it, somebody's there to pick it up. It's incredible. But there were a couple things that we had issues with, and mainly the chlorination and the chemical system, which is really not a problem because it was just a matter of adjusting.
Yeah.
Nothing serious. And Keith and his wife, Laura, I think it's Laura?
Lauren.
Okay. Lauren, both of them, it's their life. So they've been there for 30 years doing this. So they're very good at it. But there are a few, like I say, a few areas that they have to address, and they're more than willing to address them right away. And that's all I really have to say about them.
Great.
So that's where we are as far as that goes. Any questions on that? No? Okay.
So when it comes to the restaurant, like how often they're gonna be like visited, just to make sure they are continuous?
Will it be,
We have that the health inspector, the food inspector.
Yep, so they had one inspection, we had to go back a couple times for that, but then this last time, we had gotten a notification from the state of that someone got sick,
Yeah.
and it was like, well, this is the last place I ate. Turns out, it
Wasn't.
wasn't from that, but that was after we had got notified, and he rushed over there to see what was going on.
And found some things.
He found some things during that, but the person did not get sick from there, I believe.
So it was unrelated anyways.
It was
but-
unrelated.
Yeah, but a good thing,
But so they
because it
they're
looks like,
supposed to get, every twice a year, but I think they might more
Yeah.
often just to,
they had the
sure.
inspections earlier and it looks like they are
right,
one back.
yeah,
So I feel like they should be
stay on top.
Yeah, a little bit,
more than,
a little bit more closely, but
just to make sure they know,
following these
they
new
know what
protocols.
they should be doing.
Yes.
It sounds like
But I
that's what it
think
was.
that the biggest problem was the barrier between, the language barrier. That to me, probably was the biggest.
So they didn't understand certain protocols? Is that what
Exactly, exactly.
Sort of was that?
Yeah.
Okay,
Yeah.
good. Well,
Yeah. So
it's
we're going to
resolved.
we'll keep an eye on it, but
Good. I like
at
that
least-
place, so I hope so.
yeah,
No.
I hope it goes. Yeah, I hope it does.
All right.
Anything else on that? Yeah, Dick?
Not on that.
Huh?
That Camp Douglas meeting place on South Street, did we ever decide to do anything with that or not?
Was that the one that, when you're going down South Street, it's on your right?
It's on two roads. It connects, right? You're talking about that one? Connects,
Yeah, the address is.
it's a left when you're heading to Wallem Lake, but it's a
Yeah.
right with down the other South Street, right?
Oh, okay, so.
They own a lot of land right there.
South Street and,
The main entrance is South Street,
okay, I see.
yeah. But
I don't
it
know.
also is
I-
on
They-
Southwest.
Yeah, there's another,
We
As far as
haven't
what?
inspected?
Yeah, inspect the...
So the building department goes there and inspects it, and I think Danielle already went there and inspected it.
yeah, the last I knew, there was some building issues, a couple building inspectors ago, that they were dealing with. That was a few years ago, and
Yeah.
as far as I know, all the other stuff was
They just had a big meeting there,
coming back.
and I was wondering about the toilet facilities.
Well, if Danielle did visit, right?
I believe she went there for food inspection.
Food inspection, wow.
The building inspector does
The rest of it.
facilities, yeah.
Yes.
I don't know.
And if I recall, the major problems a couple of years ago were more with those individual houses for,
Oh, the cabins, like?
yeah, they have some series of cabins.
Yeah.
I think the problems were within those more or less. But I assume, 2-3 years later, those have all been resolved. But that was building anyways, that was reported on.
All right, thank you.
Okay, so that's the agent update. We go to public health nurse.
Okay, so public health nurse, I was away for almost a month, so this
Yes,
is my first.
we missed you.
Oh, thank you. So this is the first week I'm coming back, but the good thing is that everything was covered.
Yeah.
Deb, the nurse, the original health nurse who covers several times, helps us.
Right.
She was taking care of all this stuff. So nothing was piling up for me, which feels good. And so tomorrow I'll be contacting her just to exchange the information, but
Have you heard anything on COVID at all in the town?
I do get the notifications, the cases are coming, but let's be honest, most people now are testing at home. So only few test unless they are really sick or they have a doctor's appointment or procedures done or something. But most people test at home, and we know COVID is still here.
Do they,
Because I see,
do they report to you if,
no, not the home tests.
No?
No home tests. So they don't have there's no requirements
I see.
to report them. Only those who were done, the test done in the labs. These come to me.
okay.
And I've seen monkeypox is up and coming. That's now a
That's
global
another,
thing,
yeah.
huh? International.
Tomorrow I have a training on
Yeah, the
monkeypox
apparently
at
the-
11. Yeah.
It's now international. It's not country by country. so-
Yeah, I'm looking forward to
So they're getting
where
on
we
it.
are
Right.
with this one.
That's always going to be something.
Yeah. So, maybe you can give us a breakdown on your trip.
So we have to get together.
Yeah,
It's a long story.
yeah, yeah. No, I'm glad that you're back. We're happy to have you back, and
Thank you.
And knock on wood, no big fires to put out.
that's right. That's right.
Deb did a good job.
Yeah, no,
Good
she's
thing.
good. She's experienced, good nurse, and
Yeah.
she's helping. It's nice to have her.
It is. Nice to have help around.
Okay, thank you very much, Agnieszka. So we have approval of minutes here.
I didn't see anything wrong. Dick
Well,
usually...
Dick is our
I know.
speed reader.
I know, he usually picks up on those little
He's already
things.
here, he's already called me.
They're fixed.
All right. Then I make a motion, we accept the minutes from June 13th, 2022,
Second.
as is.
All in favor?
All right.
Aye.
Okay, minutes are accepted.
I just look over to Dick. Dick, do we approve? We good?
I call him the speed reader.
I know.
Can't help it, I'm sorry.
That's
He's good
okay,
at
you
it.
know, we appreciate it.
Yeah, you're good. I don't pick up on those things.
No,
You're good at that.
yeah, very good. Okay, any old business or new business? Yeah, yes, sir.
Yeah, we ran, and Kristen and I talked about it briefly. I get a phone call Friday saying that the guy, the DP guy, BP guy didn't have a key to get in the transfer station.
Oh, really?
So I whistle over, use the key to get in. I just happen to have one.
Oh,
So-
how come you have one?
Yeah, good question. So George and I set it up so that all of the 3 gates that go into the transfer station have the same key
Oh,
for
good,
the locks. So all 3, any one key opens all 3 locks.
yeah.
But the next question is, and Kristen brought it up, is that the guy getting into to mow the
Yeah, the
The other
lovely-
place.
Yeah. Cap.
requires a different key than getting into the transfer station. And I'm saying, why is that?
Yeah,
So I think what we ought to do is change the lock into the old dump to use the same key as the
yeah,
other
you
3.
could take that lock, is it the same, is it a master lock, same thing?
I don't know, I haven't looked at it.
If it's the same kind of lock, I mean,
Yeah.
master lock, you could take it to the locksmith and they'll do it right there.
Right. But the question is, do we want to do that? And if the answer is yes, then I'll take care of it.
I mean, is it really necessary?
Well, right now, the guy, when he goes in to mow, has to have 2 keys to get in.
Well, does he have the 2 keys currently, do we know? Does the guy that mow
There was
have
a
both
problem
keys?
with that. Apparently, the master key that I had written down that covers everything didn't, so he couldn't get in there.
All right, so I guess we do need to solve that
I
problem.
guess
So I
we
do
do,
need
yeah,
to-
yeah,
It'd be easier.
yeah, yeah.
Then I would say we just solve that problem.
Okay.
Yeah.
I'll
Because
take
we have
care of it.
inspections, other people go in there too.
Yeah, yeah.
Wells, landfill inspection.
Yeah, that'd be fine. I think
I'm not
that's,
voting. We just-
that's doable.
Okay.
Right.
Anything else? New business, old business?
We didn't go over, well, we don't have to go over it, but I had on the agenda for the waistband, all that paperwork.
Oh,
I
yeah,
sent it out to, it's a lot.
yeah.
A lot?
I didn't copy it.
This paperwork,
Yeah. So that's due in August.
I hope it doesn't apply to us.
Now, let me get that right, okay? I'm going to ask you about it because I know you probably read right through it
I
already.
have started. It is,
Is it dry a little bit and long?
well, no, it's complex.
And complex, huh?
I mean,
It is, it
typical-
is.
Do it.
Typical government complex.
Yeah, and they're asking, like, you have to make a list, they want us to make a list of, if I'm correct, they want us to make a list of items that we do not accept, right?
And you have to monitor that you're not
It
putting
has-
stuff in the trash.
That's right,
that shouldn't
somebody
go
has to
there.
be monitoring it all the time,
And I'm saying, how the heck do we do that?
yeah.
I thought this only applied to BP. That's how complex it is.
Yeah, it is. It really is. It's going to
How can you
be,
do that?
So we should maybe, whoever can make it, we'll have a conference call with
yeah,
Bruce.
Irene?
No, Bruce. He's the one that I got that from.
Oh, okay.
He does the monitor wells and everything.
Yeah.
He said he could help us. He said it's a little confusing.
And then once we get the paperwork done, then we got to do some training of the guys,
yeah.
Of what
yeah,
to watch.
Exactly, exactly.
and we have to figure out what they can watch.
Oh, boy. Well, yeah, you can't tell what people are throwing in the packer.
Well, the thing is, one of the reasons, they have their shirts is to make the people coming in realize that these guys are working here, watching what you're throwing out.
Yeah.
The idea is that we are watching, we are making sure that they're throwing, but they don't.
No.
You know as well as I.
And you hope people will generally
hope.
do the right thing.
Well,
But-
if it's in a bag, what are you going to do? Open the bag up and look?
No.
No, you can't, no, it's
Well, this
impossible.
sort of says.
I know.
You got to do that.
I know. Yeah, it's.
That's a lot to ask guys to go into trash, start rummaging through trash.
I would.
You can't do it.
I wouldn't allow that.
No, you can't do it. It's
That
a
would
health,
be-
safety concern.
Yeah, that's too dangerous.
It is. It is.
Yeah.
Who knows? You don't want anybody to get poked with a needle or something. Who knows what?
Right, or anything, cut,
Dirty
you know.
diapers.
Yeah.
Right.
No,
There's
it-
so many things.
Right, I try to make sure that there's somebody down below all the time,
Presence.
but, I mean, I tell them, one guy up top, one guy down the bottom, I know, you can alternate.
Take turns, circulate.
What's that?
Idea.
We have Frank pretty well trained. I think it's time to bring Bob in to get him reasonably well trained in case somebody's out sick and we need backup for the backup.
Yeah.
Oh,
So we said that we'd hire 2 guys. We've only trained 1.
yeah.
So currently, how many are working? 4? We have 4
Five.
full-time? 5.
Well, we have 4.
Full-time
And then 1
and-
on Saturday, 1 extra on Saturday.
Yeah.
An extra guy, 1 extra guy. So you're saying we could use a 6th
I'm
man?
saying Frank takes a month off while Bob's being trained, and then we sort of alternate them back and forth, but keep them up to date. So that they're both trained.
Yeah, I mean, I guess we could do that. It's,
The question is, do we want to? Or do we want to just keep Frank on, and if something happens to one of the 5, then we bring Bob
But did
in?
we hire?
right now, everything is going smoothly,
Yes, it is.
and I like that because we dealt with the other issues before, and it wasn't good, but then again, I mean, there's,
I'd like Dick to weigh in on that, I think.
Yeah.
Not this Dick, other Dick. No.
The other guy, yeah.
yeah, you're right. You're right.
Yeah, he's good. He's pretty in tune to the
He
guys
is.
and what's going on
He
there.
is. He's the senior guy there.
Well, that's why I'd like him
And
to
he-
weigh in on what he thinks.
Exactly,
I
exactly.
would be in agreement. More people that know what they're doing is better.
Yep.
I don't know as though we want to tell Frank that we're taking some shifts away from him to give this other guy unless he's.
Right.
But that's why maybe a conversation with Dick. He might be more in tune to what those guys are feeling too.
Yeah, that's
So-
a good
Yeah, it's
idea.
way more complex than it appears to.
Yeah, for sure. So I think before
It
we
is.
make any assumptions, we ought
It
to,
is.
or judgments, we ought to
And
talk.
if we start superimposing this,
Yeah, I know.
They're gonna have to go back to school.
Yeah. Yeah, you
Take
can only
a
ask
course.
those
It'll
guys.
be a 3-credit course.
Right. I mean, this is a job for like a retired guy, just
Yeah.
looking to make some.
Right, I mean, yeah, I mean,
Money.
I certainly don't want them to get into any confrontations and that kind of thing,
No.
If somebody's, well, somebody throwing something in, and you know how people
well,
can be.
we had an oil spill the other day
Did you?
in the compactor. One of the trash compactors started leaking oil. Well, I mean, someone threw oil in
Sure.
there.
Yeah, well, that happens. I mean, how the heck do you stop that? Impossible.
Education, you hope.
Yeah.
Well,
People don't realize.
Oh, they
would you do
realize,
that?
they just,
Like of all things.
yeah, I mean.
Blue
that-
paint may be one thing, but
Yeah.
just straight oil. Like I changed the oil in my truck and
Yeah,
in a Packer. Man, there's so many other things you could do with that.
I know.
So many other. I mean, not all of them are great, but so many other things you could do with that besides the Packer.
So do you and I want to sit down with Brian and go through this?
Bruce,
Bruce?
do you want to do, when I,
Yeah, I think,
so we'll do a conference call, I'll find out when he's available.
yeah, we can do a conference call on that,
So on more old new business, Dick and I don't know if, did you talk to Kristen about our meeting that we had with the Board of Selectmen? What they were looking for some more information as far as price quotes for,
We have not had that discussion in one of these meetings, but I believe Kristen brought Bob up to speed
on what,
So
Yes,
Matt asked that I get a price for trash pickup for the town,
yeah,
so I'm working on it.
as a generalized, yeah, he said there was some information you needed to have. Were you able to get that? Like how many residents, how many
It's a lot.
elderly, how many, yeah.
Right now, I'm just trying to figure out how many households, and I
Because
have to
it-
break it down into 2-family, 3-family.
Because the way he described it, it's not so much to do with how many people currently use our transfer station. You have to get a population synopsis of the whole entire town and the housing arrangement.
That's a job and a half.
Right, but I'm just trying to figure it all out right now. Yeah, so I'm working on it.
Yes, okay, good.
Kristen and I sat down with Matt and said, Matt, the mission is to figure out what the mission is.
Sounds like it's pretty involved.
What do? What kind of information? Why they need this? What?
To
How
get
it's gonna help
to
them?
get another price to give residents. like another option.
Yes.
But is this our job to provide them an option, or?
Well, so
like-
the way it was proposed was that the Board of Selectmen accepted our increase in fee, in sticker price, contingent on us researching possible pickup, which would eliminate the transfer station as an alternative, but pick up house to house. If we could get a contract for a package deal from BP, what would that look like in comparison to transfer station currently and current prices? Specifically, I think the motive was for seniors on fixed income, was the motive behind that research. And what they want to do, I think, is just be sure that the transfer station, even with a price increase for seniors, is still more affordable than a senior discounted price for curbside pickup.
When we called for curbside pickup prices, they didn't even offer senior discount.
I saw that, and I said that at the meeting.
I never heard of.
I said that at the meeting, but I think it made a couple of the members feel a little more at ease
Per
that,
household, okay.
and I made sure I noted that,
We keep pick up and that's
wasn't,
it.
that you would be the one doing the research. That I'm agreeing to this contingency, knowing fair well I won't be doing much of it. But
Thanks.
that is a lot of work for you to do.
Well, it's, yeah,
And that was what they had decided we ought to do.
That also agreed that this was not a 5-minute job. This was long-term.
Yep, yep. But the good news is we did get the price increase approved from the Board of Selectmen. So I guess, if all goes well,
Yeah.
we'll
I
still be
think-
able to function next year.
Yeah, I think, that's the key. We'll be up and functioning.
Right. Right.
It's a big increase for the town, for the people in the town. and-
It is. And I apologize, and I explained,
It's not your-
we probably should have done that last year when we noticed that there was a deficit last year, but,
But there are a lot of things that happened last year
Yeah.
till now.
right.
That changed the complete,
yeah.
not just trash
Right.
pickup and removal, but
Right.
our whole lives have been changed. So,
Yeah, so there was a lot of things that, led to this. And, I
Right.
mean, unfortunately,
And
Right,
everything goes up,
Yeah.
Gas prices, everything
Yeah.
goes up. so.
yeah, that's it.
right, maybe we could have done something sooner, but regardless, this is
Right.
where we're at. So it doesn't really matter what we could have done,
We
should have
did the
done.
best we could do to adjust it
That's it.
and, try and keep the price down as well.
That's for as long as we could, right?
Because it could easily be higher,
I'm sure some towns are a lot more, and I explained, we thought about, buying the bags, going that route to decrease the amount of waste and get people thinking more, and it came up, commercial truck came up, do we allow commercials? And I said no. There was some discussion there that there's been many commercial trucks seen in the transfer station. So, there's only so much we can do.
Right.
We don't allow it,
No.
and we try to catch people that are cheating
Yeah, yeah.
and take care of those isolated incidents as they pop up, but, you can only do so much. There's,
Absolutely. Amanda, do you have anything to add? No?
No, I'm just listening, trying to get my son in the house.
Oh, okay. Okay, that's a much bigger job, I understand.
all right.
Nice seeing you tonight.
You too.
Okay, you take care. Yeah,
Well, that's it. That was my plug, was I just
we all
wanted
set, folks?
to
Any
mention
other,
that.
anything else?
Next meeting?
Yeah, next meeting would be,
Of my phone.
August,
imagine, August already, huh? Jeez.
so today
Oh,
is 25th,
say that.
so this is for the Monday.
Poor Corey, I'm sorry. I didn't mean to rub it. I didn't try to rub it in.
No, it's
29th?
going
I know
quick.
how it is.
It's going quick, Bob.
I know how it is,
The
yeah.
29th is the last Monday of the month.
Okay, so the 29th?
And as usual, need to change it, we change it.
Yeah, right. So do we have a motion to adjourn?
So moved.
Second it.
Motion is adjourned.